Complaints of recurrence of fever. On examination, patient was in febrile, tachypnea, no evidence of congestive cardiac failure. And we started on broad spectrum antibiotic after sending blood culture. His investigation shows hemoglobin of 9.4, ESR 120, CRP 250, blood urea 48, serum creatinine 2.6. His blood culture shows virus positive Staphylococcus aureus. His chest X-ray shows multiple thin valvular cavities suggestive of Staphylococcus pneumonia, and it was confirmed by CT scan of chest. And he given for cardiology evaluations. On echocardiogram, we found that there is large fluffy vegetation attached to the septal leaflets of tricuspid valve, which is better seen in the four-chamber view. Large vegetation attached to the septal leaflets of tricuspid valve. There are smaller amount of vegetation on the anterior leaflets of tricuspid valves. It was amount of measure of 1.1 to 0.9, and this is RV inflow. This view clearly shows that large vegetation attached to the anterior leaflets of tricuspid valves, which is collapsing into right atrium, and there is some amount of flaying of leaflets towards the right atrium. We continued vancomycin and sabazolin for 6 weeks. Patient was febrile, hemodynamically stable. We discharged the patients and outpatient follow-up. On discharge time, his hemoglobin improved to 11 gram and ESR came down to 80, CRP 21. Repeated blood culture 3 sets were negative. And he remained asymptomatic for 1 year and fully active and joined to his work. After 1 year, however, this echocardiogram shows persistence of vegetations attached to the septal leaflets of tricuspid valves. But compared to the previous vegetations, this vegetation is highly echodense and collapsing into right atrium. It was confirmed by four-chamber view that highly echodense vegetation attached to the septal leaflets of tricuspid valves, and some amount of vegetation is anterior leaflets of tricuspid valves. It is collapsing into right atrium. This is a 3D view of the tricuspid vegetations. And after 2 years, he remained asymptomatic. After 2 years, we continued his echocardiogram follow-up. He continuously persistent vegetation attached to the septal leaflets. The importance of this view is as we purposefully reduce that gain settings to show that vegetation is highly echodense. It is clearly seen in four-chamber view, which is a highly echodense vegetation attached to the septal leaflets of tricuspid valves. It was confirmed by RV inflow view that vegetation is attached to the anterior leaflets of tricuspid also. This is 3D view of the current status of vegetations. So messages of these presentations are: Staphylococcal endocarditis often affects the normal tricuspid valve. Embolization occurs to the lung with staphylococcal pneumonia. Treatment with specific antibiotic for 6 weeks can cure the disease. This is rare to occur in normal individual without drug abuse or immunocompromised stage. Vegetations will persist as a fibrotic echogenic mass even after curing the disease, may be seen for many years. However, in the absence of severe ventricular dysfunction, persistent vegetations are not independently associated with late complications. Thank you.
So you said it is a Staphylococcus coagulus negative.
Positive.
Coagulus positive. It's an aureus.
Yes, sir.
What is the source?
This question, history-wise, one source is he was no other HIV or immunocompromised stage. Only history-wise, he was admitted in private hospital 7 days, and he has multiple injections from that hospital according to history-wise. That may be the one source of we can find out this patient. Otherwise, there is no other immunocompromised status or any other source for getting infection in this patient.
So, did he receive intravenous injections?
Pardon, sir?
Did he receive intravenous injections?
Yes, sir. Yes, sir. He received multiple injections in other hospital while he was evaluated by fever investigation.
Do you think that will be the cause?
Pardon, sir?
Do you think that can be the source for the organism
one chance to get this infection. Otherwise, there is no other immunoglobulin or other any negative
When was the, after admission to your hospital, when was the echo done? When was the echocardiogram done?
He came to our hospital for recurrence of fever, and within 2 days we did the echocardiogram.
Do you think that within 2 days the vegetations might have grown so much if the source was from the previous hospital?
That is possibility, sir. We are not sure about this.
Very unlikely.
Very unlikely.
Not only that, you also said that in the previous hospital you had a recurrence of pneumonia, recurrent episodes of pneumonia.
No, he was admitted in pneumonia. He was admitted in hospital for fever, then treated with pneumonia.
So
but they didn't do any echocardiogram evaluations.
What may be the cause of pneumonia?
Pardon, sir?
What may be the cause of pneumonia?
We could not have known, sir, because history was.
No, from the diagnosis.
Pardon, sir?
The diagnosis was
Staphylococcal pneumonia. This patient. Staphylococcal pneumonia.
So that must be the patient must have had already the vegetations prior to the development of pneumonia.
Yes, sir.
And did he develop any tricuspid regurgitation?
Pardon?
Did he develop significant tricuspid regurgitation?
He had tricuspid regurgitation, low pressure varieties of tricuspid regurgitation, not significant.
No. Did it get aggravated during the course of treatment?
No, improved the regurgitation.
Suppose this patient did not improve on antibiotic treatment. What will you do?
If he is not improving, we will refer to surgery to these persistent vegetations.
What type of surgery?
Vegetation, removal of vegetations and what will require.
Removal of vegetation. The surgery you are planning to do is removal of vegetation.
Yeah, if there is persistent vegetations, refer to surgery. For if the persistent vegetation, they will remove and repair the valve.
What repair? What are you planning to, what are you proposing to surgery? What can be done? For patient with a tricuspid infective endocarditis, this patient is not responding, is deteriorating. What is the possible surgery? I do not understand the question. If the patient is deteriorating on antibiotic treatment, what is the next step? You said you will refer to surgery. What is the possible surgery that can be done by the surgeon?
It is removal of vegetations and repair of valve. That is usually this kind.
What is the message you want to convey while you are studying?
My message is this staphylococcal endocarditis we can manage by medically by continuing antibiotic and serially follow up these patients for vegetation assessment.
Why he did not have any recurrence of endocarditis? For 3 years, it is a normal valve, the disease subsequently, but he carried on without any subsequent development of endocarditis.
No, he is still risk for development of reactive endocarditis.
Cancer for this sputum. Did you do
Sputum was negative, sir.
blood culture?
Blood test culture is negative. Step positive for gram positive copy, staphylococcus.
Same organisms.
Yes, sir.
What is the natural history of infective endocarditis vegetation? How many of them disappear? How many percentage will remain the same, and how many will decrease in size?
The persistence of vegetation is 25% is reduction of vegetations. Persistence of vegetation more than 40%.
How many percentage will
One
disappear?
natural history study from Massachusetts National Hospital that found that 40% of patients will persist to this
How many
vegetation.
percentage will disappear?
25%.
How much?
25%. That depends on size and that severity.
No, disappearance is not very reasons. It can embolize, it can get disintegrated, there are so many reasons. Size alone is not the important fact. Many factors are there. In this patient also, he has embolized into the lungs, that is why he developed pneumonia.
Yes, sir.
So, size of the vegetations can come down due to many reasons. Okay, right, thank you.
Thank you.
Let's give a big hand. Call upon the next speaker.